Hey everybody, how's it going? It's Kelsey. I just thought I would do a little sit-down vlog today and talk to you all about my journey with my hand. Back in November, my horse had crushed my hand between her big head and a wall, and she dislocated my fifth metacarpal, or my pinky, and she tore and shredded and severed all of my tendons and ligaments and all those important things. So after that initially all happened, I went to the emergency room. They took a look at my hand and the triage nurse had said, oh yeah, I really think that's dislocated, because it looked pretty messed up. So anyways, they admitted me, and once I got in, they took all the x-rays and everything showed up completely normal, and the doctor had discharged me without doing anything at all. So I had been going to work and going about my days as normal, and it just kept throbbing, and everyone kept telling me that it looked dislocated and it looked weird and where it wasn't supposed to be. So I ended up getting an appointment with my family doctor, and as soon as I saw her, she said, no, your hand is not right. So she immediately referred me to an orthopedic surgeon, so a hand surgeon, and about 2 weeks later I went and I saw him, and as soon as he saw my hand, he said, okay, we need to do surgery today. So I just went into that appointment thinking, you know, he would bandage it up or do something easier than a surgery, but no, it had to be a surgery that day. So I had to call into work and say, sorry, I'm not actually coming in, I have to have hand surgery. So basically he went and he put 3 K-wires or pins through my hand here, and those pins stayed in for 6 weeks. So those 6 weeks went by. They were annoying because I couldn't put my hand in water, I had a hard time washing my hair, I couldn't do my makeup, I couldn't do all of that good stuff. So when the pins came out, I was super excited, and everything looked fine until the next day. I called my doctor again and I said, oh my god, my pinky has dropped, it's dislocated again. So then he called me in right away, we took a look at it, and he said, I don't know, I think that we could maybe do some physio, do some more conservative methods before we jump into a major surgery. So I said, okay, that sounds fair. I don't want to have a major surgery unless I really absolutely have to. So I did physiotherapy with a specific hand therapist. There's only 2 certified here in Alberta, so I saw one of them. And then I saw her for many months, and then that wasn't really getting me anywhere. So then I went and I saw a physiatrist, and they're basically pain specialists, and they specialize in putting Botox in specific muscles so they start or stop working again, so you can move like a normal functional human being. So he Botoxed all my hand. He said within 7 days I should see an improvement, that my knuckles should rise again, but it never did. So Botox didn't work, and then I was trying kind of different alternative methods. I was doing infrared therapies, I was trying magnetic therapies, and just nothing was working at all. So about a month and a half ago, I went back to my surgeon and I said, nothing is working, and I'm really needing this hand to start working because I need to go back to work, I want to ride my horse, I want to go back to school, there's so much I want to do, and not having my dominant hand was really putting me in a bad situation. So he said, okay, it's time to go in for surgery. So I said, okay, well, let's do it. So I had surgery about a month and a half ago. I'd say it was a long surgery, it was 3.5 hours, and basically what they did, or what he did, was he took a bone graft from my ulnar bone, which is this bone in here, and then he fused it to my 4th and 5th metacarpal bones, which is in this area, and then to stabilize it all, he put a bunch of screws in through my 4th and 5th finger bones, and it seems to be working. It's been a month and a half, and I have full hand function, and it's so exciting, and I'm so happy that it worked. Of course, it was terrible after surgery, pain-wise, and you know, trying to get back into the swing of things. And I'm still not allowed to do a lot. I'm not allowed to ride my horse. I'm not allowed to lift anything heavy. I'm not allowed to grip things, even though I have been, but my surgeon thinks I'm so bad because I'm a very bad patient, but it seems to be moving along now. And I'm gonna go ahead and I'm gonna zoom you guys on in and we can take a closer look at my scars. So I don't know how well you're going to be able to see everything, but basically this scar right here was where they took some of my bone, and then that bone they fused in this area. So this is one giant bone now. So they did that, and then on the side of my hand here, they cut it open, and then he put in some different screws to hold everything in place. And then right here, I guess right before they were closing me up, something broke in my hand or something, I'm not really sure, so he had to go back in and fix something to have another incision. So that's basically what my hand looks like. It doesn't look too terrible aesthetically now. Hopefully the scars will fade, but as you can see, my hand is completely functioning now. I have a 5th knuckle again, which is really exciting, and I can mostly straighten. This pinky still needs a little bit of work, and I can make a fist now, which is super exciting. And yeah, so I have a functioning hand. So I know this is completely different than any video that I usually do, but my hand has been a major part of my life the past year, so I thought I would go ahead and open up myself some more so you guys get to know me a little bit better and do this video, and expect some more beauty videos coming up very soon, and I'll talk to y'all later. Bye.